So as you know, when you take someone's pulse, you're really measuring the blood flow in the brachial arteries, and those come off the great vessels in your chest. It's different slightly on the right than the left side. And if someone is pulseless, but they're still alive, they're not dead. If they're pulseless, but they're still alive, it usually means there's some more proximal occlusion in the brachial arteries. And so in the great vessels of the chest coming off of the aorta, the right side and the left side look slightly different. And so on the right side, we have a single trunk, the brachiocephalic. The brachial part is the part that's providing the brachial artery, and the cephalic part, of course, is the carotid artery and the vertebral artery, and those are going to the intracranial circulation. In the left side, the common carotid artery comes directly off of the aortic arch, and the subclavian on the left supplies the arm and is under your clavicle, becomes the brachial, and the vertebral artery coming off of the subclavian in that side. So when we have pulseless disease, we are missing the pulse, and that should be a sign to you that we have proximal disease in the great vessels of the chest. And so the thing that comes to neuro-op is when you have inflammation in those arteries, and that is arteritis. And because these are very big arteries, it's got to be a large vessel arteritis. And so the large vessel arteritis that we see in neuro-op in elderly patients is, of course, giant cell arteritis. And in young patients, Takayasu arteritis. So both giant cell arteritis and Takayasu arteritis are large vessel vasculitis that can produce pulseless disease. So the most common disease that we see when someone is pulseless, if they're alive, is pulseless disease. And the most common cause of pulseless disease in a young person is Takayasu arteritis, in an old person, giant cell arteritis. And both have diagnostic criteria. For giant cell arteritis, of course, we're going to do a temporal artery biopsy. They're both going to have elevated acute phase reactants because they're both arteritis. So they both have elevated SED rates and CRP. But Takayasu arteritis usually going to stay in the aorta and its branches, including the lower branches of the aorta. And whereas giant cell arteritis has a predilection for the scalp, the external carotid artery branches, and the ophthalmic, and not so much for the intracranial lesions, even though temporal arteritis can appear in any part of your body. So if you've got someone who's got the history of pulseless, think about pulseless disease. If they're young, less than 40, Takayasu. If they're old, greater than 50, giant cell arteritis. Is GCA a temporal artery biopsy? And you should know a little bit about the anatomy of the great vessels in the chest.